Hello everyone, I'm Dr. Adam Maulana. How are you today? I hope you and your family are always blessed with good health, peace of mind, happiness, and well-being. Thank you for joining me again for another discussion about ear health. Today, we are going to talk about a condition that many people experience. Primary tinnitus, a sensation of hearing sounds such as ringing, buzzing, or whistling when there is no external sound source. Many people who experience tinnitus naturally ask, is there a medicine that can completely make this sound disappear? That is a very understandable question. However, based on current scientific evidence and clinical guidelines, there is currently no single medication proven to consistently cure all cases of primary tinnitus. This does not mean, however, that tinnitus cannot be managed. In fact, there are several strategies that can help reduce the impact of tinnitus and improve quality of life. Primary tinnitus usually does not have one specific cause that can simply be corrected. It is often associated with hearing loss and changes within the auditory system, including the way the brain processes sound. Because its underlying mechanisms are complex, management does not focus solely on medication. One approach with relatively strong scientific evidence is cognitive behavioral therapy, or CBT. This therapy is not designed to directly switch off the tinnitus sound. Instead, CBT helps people understand and change the way they respond to tinnitus. When someone constantly focuses on tinnitus, becomes afraid of the sound, or feels increasingly anxious whenever it appears, the tinnitus can become more noticeable and disruptive. CBT helps patients develop healthier thought patterns and responses, allowing the sound to become less dominant in their attention and daily activities. In other words, the goal is not always to eliminate the sound directly, but to reduce how strongly tinnitus affects a person's life. Another strategy is sound therapy. The principle is relatively simple. A person may use comfortable background sounds, such as nature sounds, white noise, or gentle environmental sounds. The goal is to make tinnitus less prominent and easier to ignore. However, it is important to understand that the benefits of sound therapy can vary from person to person. Therefore, it is better viewed as one possible management option rather than a treatment guaranteed to work for everyone. Now, what if tinnitus occurs together with hearing loss? In that situation, hearing aid evaluation can be an important part of management. When a person has reduced ability to hear sounds from the surrounding environment, tinnitus may become more noticeable. By amplifying environmental sounds, hearing aids can improve communication and, for some people, make tinnitus relatively less prominent. In addition to these approaches, education and counseling also play an important role. Patients need accurate information about tinnitus. Understanding that tinnitus does not necessarily mean that something is continuously getting worse can help reduce fear and excessive attention toward the sound. I would also like to clarify the role of medication. Certain medications may be used to manage other conditions that occur alongside tinnitus, such as sleep difficulties, anxiety, or other medical conditions. However, this is different from saying that those medications are proven cures for tinnitus. Current clinical guidelines do not recommend routinely using certain medications, such as antidepressants, anticonvulsants, or anti-anxiety medications, solely for the purpose of treating tinnitus. Similarly, supplements such as ginkgo biloba, melatonin, or zinc do not have sufficient evidence to be routinely recommended as treatments for every tinnitus patient. Therefore, we should be cautious about claims suggesting that a particular medication, vitamin, or supplement can permanently eliminate tinnitus. It is also important to determine whether the symptoms actually represent primary tinnitus. Not every ringing sound should automatically be considered the same condition. A doctor may evaluate the patient's medical history, examine the ear, and perform a hearing assessment when necessary. Tinnitus that occurs only in one ear, persists over time, is accompanied by hearing changes, or has other concerning characteristics deserves further medical evaluation. The purpose is to make sure that there is no other underlying condition requiring specific treatment. So, does a person with primary tinnitus have no hope? Absolutely not. The absence of one universal cure does not mean tinnitus cannot be managed. Several approaches may help people adapt and reduce the burden of tinnitus. A combination of education, counseling, CBT, sound therapy, and management of hearing loss can be considered according to each individual's needs. We should also understand that successful management is not always measured by whether tinnitus disappears completely. In many cases, success means being able to sleep, work, communicate, concentrate, and enjoy everyday activities without tinnitus constantly interfering. As a final message, I want to remind all of us not to lose hope simply because a particular condition does not yet have one direct cure. In healthcare, the goal is sometimes not only to eliminate a symptom, but also to help a person regain comfort, confidence, and control over daily life. Listen to your body, do not ignore persistent symptoms, and avoid rushing into treatments based on unproven claims. Good health requires patience, knowledge, and wise decisions.